Vision is a result of the interaction between different parts of the eye and the brain. The quality of vision depends to a high extent on the performance of the natural lens, also called a crystalline lens. This transparent and flexible body is located in the capsular bag behind the iris and is held in position by zonular fibers. In a healthy eye, a clear and bright image can be seen when the light rays pass unhindered through the crystalline lens and focus directly on the retina at the back of the eye. With age, the crystalline lens becomes thicker and less transparent, preventing light from passing through. This clouding of the crystalline lens, called a cataract, leads to a gradual deterioration and, if untreated, to a complete loss of vision. The only effective way to treat cataract is to remove the clouded natural lens and replace it with a clear implant, a so-called intraocular lens, IOL. Cataract surgery is one of the safest and most common surgical procedures worldwide, performed generally on an outpatient basis. The surgery is carried out in the anterior part of the eye that consists of the sclera, cornea, iris, and the crystalline lens. The surgical procedure normally takes between 15 to 30 minutes and is pain-free. In general, local anesthesia is used. The most common form are eye drops applied directly to the eye prior to the surgery. First, the surgeon makes a main incision of about 2 mm at the junction between the cornea and sclera. The intraocular lens will be inserted through this incision. Then 1 or 2 additional micro-incisions are made to enable the manipulation with surgical instruments. Next, the surgeon applies a jelly-like transparent substance called ophthalmic viscosurgical device, OVD, inside the interior chamber. This substance protects the internal structures of the eye and creates space for the surgeon to manipulate with the surgical tools. Then, the surgeon carefully opens the capsular bag where the lens is located and creates a round, continuous opening of approximately 5.5 millimeters. This opening allows removal of the cataract lens without removing the capsular bag. Using an ultrasound probe, the cloudy lens is broken down and gently removed via suction, leaving a clear capsular bag. The red color that can be seen after the removal of the cataract lens is a result of the reddish-orange reflection of light from the eye's retina. Finally, the clear artificial lens is implanted using an injector. The intraocular lens unfolds gently into the capsular bag, replacing the removed natural lens. The implanted intraocular lens stays fixated and centered in the eye and is neither visible nor perceptible. The incisions are self-sealing. The IOL provides the main functions of the natural, healthy lens, enabling the patient to see clearly again at one or more distances. Modern IOLs, such as trifocal lenses, provide good vision at near, intermediate, and far distances, giving patients a high chance of no longer requiring eyeglasses.
In this part of the video, I will explain the different lens options that are available to you during your cataract surgery. During your cataract assessment consultation, we will perform a number of tests and measurements of your eyes. This information is used in specialized formulas to calculate the optimal power of the intraocular lens that will be used during your lens replacement procedure. Not so long ago, we did not have much of a choice when it came to cataract surgery. When the cataract was removed, a monofocal lens was implanted, and most people were still totally dependent on glasses for distance and near vision postoperatively. Nowadays, there are a number of options available to try and make the patient less dependent on glasses. It is important to remember that there is no intraocular lens option that can guarantee perfect vision under all circumstances. Even the premium lenses have limitations and side effects, which we will discuss now. If you suffer from any pre-existing eye conditions, such as macular degeneration, diabetic retinopathy, or advanced glaucoma, you may not be a suitable candidate for a premium intraocular lens. Let's first talk about monofocal intraocular lenses. These lenses correct one focal distance and are mostly used to fully correct your distance vision so that you are less dependent on glasses for driving and watching TV. If you want to see anything closer, like reading, working on the computer or laptop, looking at your cell phone, then you will always need to put glasses on. Another way to use a monofocal lens is to do monovision, where one eye is corrected for distance vision and the other eye for intermediate vision. This will make you less dependent on glasses for intermediate vision, like working on your computer, but you will still need to wear readers for close-up work. A group of lenses are multifocal lenses. Multifocal lens implants are a good option for people who want to be less dependent on glasses altogether, for those who do not like wearing reading glasses. This lens is designed with several concentric circles, providing multiple focal points, thus allowing for distance, intermediate, and near vision with each eye. Because of the circular design, you don't have to adjust your head position or aim through a specific part of the lens like you would have to do with multifocal spectacles. One can read in any position, including looking upwards and to the sides. The lens does, however, have a sweet spot, which is set for about 35 to 40 centimeters. If you have to do something like threading a needle, or if you have a certain hobby that requires a very close working distance, like jewelry making, you will still need to wear a spectacle with some extra magnification. So the big advantage of a multifocal lens is that it can potentially make you independent of glasses for the most part of your day. It does, however, come with some potential side effects. Firstly, halos at night when poor light conditions. You should expect to see halos post-operatively, especially during the first couple of months after your surgery. This is normal. These halos are caused by light falling onto the concentric circles of the lens design through a dilated pupil in poor light. You will see a clear light source, like when looking at a traffic light, with one or more dull rings or halos around it. Dysphotopsia, often described as arcs of light in the peripheral vision, streaks or starburst, are also potential side effects of a multifocal implant. Most people will experience increased light sensitivity after cataract surgery, So have some sunglasses ready to wear post-operatively should you experience increased light sensitivity. You will also experience some reduced contrast sensitivity, which means that you will need good light to read well. There will also be some slight adjustments in your color perception, and most people report that things look more like a cool bluer white than warm white. But because of neural adaptation, these side effects are usually temporary, and the majority of people will not be aware of them after a few months. For people who choose multifocal intraocular lenses, the advantage of being independent of reading glasses far outweighs the occasional mentioned side effects. Medical aids consider multifocal lens implants a luxury and therefore will not cover the full cost of the lenses. They will only pay as much as they would for a monofocal lens, and the balance will be out of your own pocket. The last group of lenses are EDOF lenses, which is short for Enhanced Depth of Focus lenses. They are also premium intraocular lenses. They are not multifocal lenses, but they offer more depth of focus than monofocal lenses. EDOF lenses provide a single elongated focal point rather than multiple focal points to enhance depth of focus. These lenses can be used in two ways. One can aim to correct both eyes for distance vision and then also have some improved intermediate vision without the need for glasses. In this case, one will still need to wear reading glasses for any close-up work. Alternatively, and this is how the lens is used most often, the dominant eye can be corrected for distance vision, also providing intermediate vision, while the non-dominant eye can be corrected for intermediate vision, also providing some near vision. Creating this slight offset between the two eyes aims to make one less dependent on glasses, but not completely independent of reading glasses. One is usually not aware of this slight difference between the two eyes, except if you compare the two. The advantage of this lens is that it does not have the concentric circles and therefore have significantly less halos. This would therefore be a good option for people who drive a lot at night or who are worried about how the halos will affect them. It would also be a good option for people who are used to monovision with contact lenses. One should, however, expect to have to wear reading glasses at least sometimes, if not all the time. Medical aids also consider these lenses a luxury item and will also not cover the cost of the lenses in full, as with the multifocal lens implants. If you have a significant degree of corneal astigmatism, this will need to be corrected with a toric lens. All three of the options explained above can come in a toric version. After we have done all your preoperative tests, we will inform you if you need a toric lens. In order to optimize your post-operative refractive result, it is important for us to know if you've had any previous refractive eye surgery like Lasik, PRK, or radial keratotomy. These procedures alter the natural shape and curvature of your corneas and make our formulas slightly less predictable. This means that we may not achieve the intended target. We call this a refractive surprise. Dr. Aleksic might advise against using a premium intraocular lens in these cases, but each case will be considered individually. People with high refractive errors or very steep or very flat corneas also fall into this category and may have a refractive surprise. If we find that you fall into this category, it will be discussed with you in more detail. In cases where we do not achieve the desired post-operative refractive result, and it is unsatisfactory for both the patient and the surgeon, there are ways to enhance your vision. Firstly, one can wear corrective glasses or contact lenses if and when needed, like for reading very small print or driving at night. A secondary surgical procedure may also be considered. If your corneas are regular and of normal thickness, laser enhancement might be an option. Alternatively, a piggyback lens implant can be used to fine-tune your result. Choosing which intraocular lens to use can be difficult. We are here to guide you, but ultimately only you can decide which option will best suit your lifestyle and address your visual requirements. Please feel free to contact us if you feel the need to discuss your options in more detail. What we need to know from you before surgery takes place. Please inform us of any previous eye surgeries. We need to know about any medications you take, especially blood thinning or prostate medications. If you are allergic to any medications, if you suffer from claustrophobia, if you believe you cannot lie still in theatre for surgery under local anesthetic. Please note, you need to take your eye drops to theatre. You will be provided with a prescription for 3 drops, an antibiotic and 2 anti-inflammatory eye drops. In-room follow-ups are not included in the surgery fee. The following complications can occur 1 to 7 days after surgery. Infection may occur. Most infections happen 2 to 7 days after surgery. If your eye becomes red and painful and your vision becomes blurred, please let us know straight away. Something which is most prevalent in the first evening post-surgery is what we call exposure keratopathy. This is dryness caused to the cornea by incomplete or inadequate eyelid closure. Light sensitivity is common after cataract surgeries, especially among patients with light-colored blue or green irises. This settles down in a few weeks during the recovery period after cataract surgery as the brain adapts to the new normal level of light intensity. Should you experience poor vision and light sensitivity with a painful red eye within the first 2 weeks after surgery, then please contact us to exclude the possibility of an eye infection. The following complications can occur from 1 month after the surgery. Cystoid macular edema, or CME, can occur within 4 to 6 weeks after surgery. This is when there is swelling of the area of the retina responsible for visual sharpness, causing blurred vision. The swelling usually settles, but you may need an anti-inflammatory eye drop or medication to treat this. If you notice gradual worsening in your vision or blurred vision a few months or years after surgery, this could be what we call clouding of the lens, or PCO. This can be treated with a very simple laser procedure called YAG capsulotomy. It is important to note, although cataract or lens surgery is very safe and predictable, it is not without risks and no surgeon can 100% guarantee perfect results. Refractive surprises can be found following cataract surgery and refractive lens exchange. Accurate biometric analysis selection and calculations of the adequate intraocular lens and modern techniques for cataract surgery all contribute to achieving the goal of cataract surgery as a refractive procedure with no refractive error or ametropia. However, in spite of all these advances, residual refractive error still occasionally occurs after cataract surgery, and it must be noted that the surgeon cannot predict the visual outcome of his operation for every single person. This could be treated with a spectacle, laser correction, or a correction that we call a piggyback lens. A cataract is a common problem where the natural lens of your eye becomes cloudy. If your vision is getting worse and affecting your daily activities, cataract surgery should improve your vision. But generally speaking, the surgery is not considered an emergency and you are welcome to postpone or cancel your surgery at any time. This type of surgery is usually safe and effective, but complications can happen. You need to know about them to help you to make an informed decision about surgery. Knowing about these complications will also help to detect and treat any problems early. Therefore, we ask you that you read the information provided to you. Please ask your surgeon or doctor for more information about the risks that are specific to you or if there is anything you do not understand. This video is intended for information purposes only and should not replace advice that our relevant healthcare team would give you that would be specific to you.